Everything, everything gonna be all right this morning.
All right. We're off, man. Locked and loaded with the good doctor today. Jeffrey Wilson coming to you live and direct with another episode for the archives of It's Me Speaking to You. Man, the serendipity, the synchronicity of the universe is really awesome, man. Today we are talking to someone who's just really blown. I've known of him, obviously watched him on Joe Rogan. I recently interviewed Lisa McClellan, who's been taking care of her brother, Gerald McClellan, for almost the last 30 years after he suffered a traumatic brain injury in his super middleweight fight against Nigel Benn back in 1995. When I started talking to her, she had mentioned to me before she was looking at doing stem cells and all this stuff, because I see a lot of athletes, MMA, wrestlers, et cetera, who are doing stem cells, et cetera. She's like, no, I'm jumping into this different protocol with Dr. Mark Gordon. And I was just kind of fascinating. Let's talk about it. And the just light years of leaps that have been made by Gerald utilizing Dr. Gordon's protocols in just 4 months is absolutely insane. We're going to talk all about it. But again, this is Dr. Mark Gordon. He is a neuroendocrinologist, author of Traumatic Brain Injury, A Clinical Approach to Diagnosis and Treatment. He's also created, and definitely watch it, ladies and gentlemen, it's called Quiet Explosions. It really goes deep into this conversation that we're going to have today about traumatic brain injury and some of the not as conventional treatments that he and his crew have leaned into, which has just yielded amazing results. Doctor, how are you today, sir?
I am still live with a pulse. Thanks
Sweet.
for asking.
We woke up today, so everything else is gravy. I love
Absolutely.
a good origin story, sir. I'm a big comic book. I used to be a comic book fan, like superheroes, etc. When did the bug bite you as a neuroendocrinologist? When did this start? When did this start with your passion for this work?
It was very personal. In the 90s, I was put on antidepressants, and the antidepressants didn't work. And one of my escapes is to read. So I was reading, and I came across this growing volume of information that with head trauma, it disrupts chemistry in your brain, which creates, these psychiatric, psychological problems, depression, anxiety, and all that stuff. And I went to a lab, had my blood work done, and bingo, there were 3 hormones that were deficient. And within 90 days of getting them corrected, it's like my world returned, and I was younger, I was more energetic, and pursued this as, pursued it like a vampire going after its first meal after being converted, if you, all those movies we see.
Of course.
Anyway, so that is what started me. And, from 95 until about 2007, I was working with the NFL, with professional sports people, with bikers, this group, that group, and so forth. And in 2007, realized that this technology that we were developing had a better service, and that service was with our veterans and our military. And in 2009, I flipped into focusing on the military, put advertisements out there offering free medical care to our veterans, military, and started building a group of veterans who, 44 suicides a day, still 44 suicides a day, even though they want to tell you there's 16.7. And when I asked the person who said 16.7, how do you get a 0.7 person committing suicide? It's either 16, 17, whatever, 16 point. I know statistics, but you can't have a part of a person. Anyway, not even if they're midgets. Anyway, the issue was and still is that we're losing too many of our heroes, our warriors, to something as simple as a biochemical change in the brain that's precipitated by any number of traumas: blast trauma, IED, mortar, being hit on the head, slip and fall, bicycle accident, roller skating accident, skiing accident, car accident, motorcycle, whatever. They all lead down the same pathway of generating an inflammatory environment in the brain. And that inflammation alters the entire chemistry of the brain, so you can't make brain hormones. And that's where the sliding down or sliding back, whichever direction you want to go, occurs. And you end up with psychiatric problems, cognitive impairment, emotional volatility, insomnia, and a whole litany of things that I went after to determine, to learn why these things were happening. It's not just, oh, you're depressed. Take this little green, purple, blue pill and this orange and red pill and this white pill and this 5 other pills to help you with the depression. What I did was I said, okay, where is the Prozac gland in our body?
Seriously.
You know, and I did a tongue-in-cheek presentation for RadFest 2016. It's on my website called In Search of the Prozac Gland. And the argument was, why are we putting things into our body that aren't in our body naturally? Why don't we go looking for the cause? And so in 2004 is when I started focusing on the causation that creates the changes in the chemistry of the brain that leads to personality.
And I have to ask, in this in the medical world of just overprescribing these things, how much resistance did you get? Like, hey, let's stop just prescribing these synthetic chemicals and start looking at the root. How much resistance did you get from that, for lack of a better term, like allopathic or medical community?
Well, I don't know directly because I'm kind of an outsider. I'm an outlier. And I really, you know, up until about 2001, I was playing in the game. And then as I started finding that the benefit of the things that I was trained to use were not beneficial, I became an outlier. And therefore, I don't know directly what the problem, you know, what the resistance is, what the pushback was. I hear it through my patients who, you know, they go in and they're on a whole bunch of medication through the VA, and they're on our program for 3 months, 6 months. They go back to the VA, and they're no longer on the medication. Well, I don't take people off of medication. I send them back to their primary. But most of the guys and gals who go back to their primary and say, hey, I want to get off these medications, they say, no. I put them on it, you stay on it for life. And they go and find another doctor who specializes in detoxing from chemistry. And then, you know, they go back and they say, look, I'm off all your stuff you gave me. And on this nutraceutical protocol, correcting my inflammation, correcting my neurosteroids, the hormones in my brain and below my neck. And I am just back where I should be. A great example, and you mentioned it, the documentary movie, Quiet Explosion, that I had nothing to do with. It's my partner, Andrew Marr, and his brother, Adam Marr. Adam Marr now is leading the charge on psychedelic-assisted therapy from state to state to state with a number of organizations. His brother, Andrew, was the one who was on 13 medications, full-blown alcoholic after being blown up in his 4th tour of duty in Afghanistan. And he ended up coming to us after, you know, a year or two of going through the traditional approach. He came to us, and within a few days, he's starting to feel better. Within less than 90 days, he's like kicking it. And he's off all his medication, no longer drinking, no longer suicidal. His wife, Becky, would tell me she'd find him in the hall closet in the fetal position with his sidearm in his mouth. I mean, just
in that, and I don't know if you did this deliberately, you directed it. I mean, again, Quiet Explosions. Andrew Marr was heavily featured in this, and as they talked about Andrew in his closet, it was almost this cross cut of his little son hiding under kind of this little closet. I mean, as if he had seen his dad. I don't know if that was kind of the inference, but that's kind of what I got. It was him doing that was so ubiquitous, if you will. His little son was emulating that behavior.
Right. Well, the point was what held Andrew back from doing anything was the greater fear of having one of his 7 children finding him. Okay, that was what really kept him back from completing the task that he was trying to do. But what happened was he was in San Diego at a brain health center trying to get his brain fixed. I had sent him an email. I saw him on a program, and I sent him an email and said, look, I'm not crazy, but I think I might have a solution for your problem. And we chit-chatted a couple of times. You can tell that he was very suppressed on 13 medications, and ends up driving up from San Diego to my office, which is Encino, and it's, 405, the horrible 4:05, and he comes up, and he comes into the office. I draw his blood, and I start him on treatment right then and there. He drives back to San Diego a few hours later, and I get a phone call that, from his mother, from his wife, that he was calm, he wasn't explosive, he was communicating with them, all within a very short period of time of starting him on treatment. The treatment was a blended form of testosterone propionate and cypionate, which gets into the brain and body rapidly. And that's what, based upon dialogue with him, realized that he was deficient in a number of hormones, which were validated by the blood work that we do, the comprehensive 28-point biomarker panel that we developed over 14 years. It's now been fully implemented since about 2010.
And the biomarkers is something that's hugely important in this. And not to jump ahead, and you might have mentioned this before, but you had said initially, like, they had put you on a bunch of antidepressants. You're not coming into this, it's anecdotally necessarily, just anecdotally. You suffered your own set of concussions. I believe it was 1997, multiple.
Yeah, 6 of them.
Yeah. Wow.
Hit by a car was at 13 was pretty bad. Being hit on my bicycle, knocked down, and I ended up with prospective amnesia. I basically forgot about it. I mean, it was only sitting with one of Lance Armstrong's group that talking about bicycle accidents that I had this, like, a video playing in my mind as we're talking about bicycles, and all of a sudden I see this video of the accident that I had with his car. I made a right-hand turn on a street, Manning Avenue, and this car kept on going and hit me. So anyway.
Well, like I said, so you're not coming in at this just from the academic standpoint. You've been through this, and I find it fascinating through all just watching your work. And like I said, I was familiar with you before, but it's fascinating that we're actually having this conversation. But you have an exception. You take exception to. You kind of talked about it just a second ago, PTSD and the term and the diagnosis, because not all necessarily TBI or brain trauma has to be traumatic. And, it does, at the end of the day, alter your brain chemistry. And if you don't mind, there's so many different names and terms. These happen to stick out to me. And pardon me if I put the wrong emphasis on the wrong syllable. Tell me what the role fractalkon, and cortisol is in your assessing how this is altering the brain chemistry and what these chemicals are doing.
Yeah, to back up a little bit, yes, there's traumatic and non-traumatic injuries, and the area that I'm working on in traumatic is subconcussive and concussive traumas, which we'll cycle around to a little bit later. But to answer your question more directly, the difference between TBI and PTSD, in terms that I don't agree with, right, especially the PTSD, which for me has always been a missed opportunity to treat a traumatic brain injury. The psych world, psychologists, psychiatrists, neuropsychology, they believe that PTSD is a neuropsychiatric condition that just appears from stress. Okay? Well, tell me someone who doesn't have a traumatic brain injury who doesn't develop stress. Tell me someone who doesn't have some challenge in their life, fracture of a bone, which doesn't lead to inflammation and stress. And that stress is all based on cortisol. Well, it turns out that if you really were a purist, then the purist between TBI and PTSD is PTSD has no prior physical trauma. It's 100% psychiatrically produced. And how is that produced? Stress. Family stress, social stress, work stress, environmental stress, whatever kind of stress you want to put an adjective in front of it, that's a form of stress. And what happens under any form of stress, cortisol goes up. Well, it turns out that there is a chemical called a chemokine called fractalkine that is produced by our neurons to cause the immune cells in our brain called microglia, which are responsible for producing inflammatory chemicals that they call cytokines. They call them pro-inflammatory cytokines. Well, as long as there's healthy neurons producing a healthy amount of fractalkine, these Microglia are kept in a sedentary state where they're not dumping cytokines. We've heard of cytokines through cytokine storm and what caused a lot of people with COVID to die from wasting of their lungs. Their tissues became friable and so forth. So what happens is under stress, cortisol goes up, shuts off fractalkine. The microglial cells, the immune cells of the brain start dumping inflammation, and that's what causes the alteration in the chemistry. Like, how is that possible that one thing creates another? Well, it turns out that when inflammation occurs in the brain, there are things called free radicals. We've talked about antioxidants, these are oxidants, these free radicals. There's one free radical that's called peroxynitrite that inhibits enzymes. Enzymes are little proteins that convert one chemical to another, like cholesterol is converted to pregnenolone. Pregnenolone is converted to DHEA. DHEA is converted to testosterone by enzymes, and it's a cascade. So what happens is this peroxynitrite damages the ability of an amino acid called L-tryptophan, converting to serotonin. No serotonin, depression. And then serotonin to melatonin so you can sleep. So you end up with depression, you end up with sleep deprivation, which leads to personality change, mood swings, emotional volatility, cognitive impairment. A whole bunch of things go awry. And it's due to disruption of a chemical pathway in the brain. Presentation that I've given now for the third time about Parkinson's disease. It turns out that our body has two walls of defense, one under glutathione. Everybody might have heard of glutathione. It helps to detoxify you. So if you're drunk, you can take glutathione and liposome, and in a half an hour, you'll be clear-minded again, as though you've been detoxed. And then another thing called SOD, superoxide dismutase. These two systems help to remove oxidants, free radicals from our system. Well, it turns out that this peroxynitrite selectively damages the area of the brain where dopamine is produced. Without dopamine, you develop Parkinson's. So we know that this peroxynitrite specifically damages the system of defense, and that's why people develop Parkinson's. So we've reversed Parkinson's in a couple of cases, and dementia disease is my greatest achievement in 6 patients right now is reversal of a reversal or remission of multiple sclerosis off all medication.
I heard that it was I think if it's the same person, it was a military gentleman, and they had hopped him up on a bunch of stuff, and then within a very short period of time, you had him completely turned around. If it's the same gentleman I'm thinking of.
Yeah, Tim, and he's given me license so I can talk about him. He's got a wonderful 2.5-minute video that he sent me that I incorporated into a larger video. So the second half of the video gives the science behind what we're doing. Multiple sclerosis is an autoimmune inflammatory condition. Inflammatory, degenerative, just like ALS, Parkinson's, Alzheimer's. And if you can get your hands on to the processes that create the inflammation, you can slow down the process. As well as in Tim's case, he was 50% better in 30 days and 90% better in 90 days. He's now almost 12 months in remission, and he had lost vision in his left eye. He had lost some function in his right hand and right leg, and that's all gone. He's had no symptoms for the past almost year, and he's number 6. It was a funny story he tells on the video. You can go and listen to it, but in a nutshell, he was just given the diagnosis by the Veterans Administration that he had multiple sclerosis, and he rejected any treatment because he's a smart guy. He was head of the nuclear power plant for a major carrier in our Navy.
Wow.
And yeah, so top guy, smart guy. And he was driving home from the VA. He turns on his favorite talk show. And just as the time that he turns it on, Joe Rogan and I are having a conversation. Andrew Marr is there. about one of our Navy SEALs who was on our protocol, and he was diagnosed with multiple sclerosis. In 60 days, he was 50% better. So that's how fate functions. Like you and I, Jeff, met fate.
Yeah.
And Tim and I, and Tim's life is now totally changed. And he, he's a father, he's a husband, he's a son, just incredible.
And I told Lisa, and I talked to her about her and you, and I use this term often. I said this to you. I was gassing you up because I couldn't believe I was able to talk to you. And you're like, cut the bullshit. I'm just a regular person. I get it. But I'm just saying, I like to call him, you're like an altruistic agent of alchemy. No, you're not transmuting lead into gold, but you are literally transforming the quality of people's lives. And you're doing that, but the fact that you're doing it in such a short period of time, like Lisa blew me the fuck away when she was saying what's happening to Gerald in 4 months, man. I know what she's been dealing with the last almost 30 years, and the story about the M&Ms or whatever it was, and right. Lisa, I gave him M&Ms and he only took 3. Like, Gerald, how the fuck do you know how many M&Ms he took? You can't see. I mean, I got choked up, man.
Blind. Yeah.
It just, because that kind of the power of what you're doing just blows me away. Anyway, something Joe Rogan, a person he has on his show and has had often, Dr. Rhonda Patrick, and something she brought up. She's awesome. She's amazing. But another name that stuck with me, polymorphisms. At the end of the day, our inflammation is the root of all of our shit, a lot of our dis-ease, if you will. But our tell me if I'm wrong, our inflammation is going to manifest differently, obviously because of maybe our genetics, but maybe also our polymorphisms and what we're deficient in will kind of dictate how this inflammation develops. Is there any correlation between polymorphisms and how our inflammation develops?
Absolutely. We had lunch together, I think in San Diego, and wow. It was just fascinating. Her husband was there. Andrew was there. Mitochondria, all are mitochondria things. Now, to answer your question, the polymorphism, or the reason why each of us responds differently, has been part of our work that we're doing as well. And my belief is that lifestyle plays an important role in how we respond to things. Now, how did I get on this trail? Was because I had a group of military who were exposed to the same blast wave. They were proximal to each other, in proximity to each other when this blast wave occurred. And each one of the individuals had a different reaction to the blast. How do you account for that? Well, I looked at lifestyle. Now, what lifestyle means for me is their nutrition, their hydration, their exercise. Do they drink alcohol? Do they take supplements? Do they have problems with their gut? Because each and every one of these areas has influence on the manner in which our body produces certain chemicals and how we defend ourselves from those chemicals. It's like, we know from the work done by Colonel Michael Lewis, the book called When Brains Collide, that if you're taking fish oil, and that was his thesis and premise when he was in the military, he's an MD, he tried to get the DOD to take more fish oil, or to provide more fish oil. Why? It's a protective barrier. And think of it as Kevlar, which are plates of protection that you put in your vest. So if a bullet comes, the more Kevlar you have, the more it bounces off, So we can do certain things nutritionally, quercetin, vitamin D, gamma tocopherol, vitamin E. We can use N-acetylcysteine, glutathione. Stay away from alcohol, which strips the layers away. Narcotics strip some of the layers away. Also, hormones. How do hormones play a role in inflammation? Well, it turns out that our hormones that we refer to as gender hormones, sex hormones, these have what we call pleomorphic or pleiotropic effect, many effects. And the most important one for me, or for you, for males as well as for females, is testosterone. Testosterone has the ability to turn on in these microglial, these immune cells, an anti-inflammatory chemical called interleukin-10. So good levels of testosterone infers upon you protection against overwhelming amount of inflammation in the brain. It specifically drops 4 key pro-inflammatory cytokines, interleukin-1, 1-beta, 6, and tumor necrosis factor alpha, which create havoc on the chemical pathways in the brain. They can lead to atrophy of the brain. One of the papers that I'm working on right now is the relationship between chronic traumatic encephalopathy, TBI, PTSD, Alzheimer's, multiple sclerosis, and Parkinson's. They all have relationships. And when I did a deep dive beyond my usual capacity into the multiple sclerosis world, I found a few articles that showed that if you had traumatic brain injury, you're 30% greater risk of developing multiple sclerosis. I go back to Tim for clarity. I knew he had loss of consciousness and traumas when he was in the military, but he also had 2 loss of consciousness, traumatic ones, in his younger age. And this article states that when you're young and you have traumatic brain injury, you're 30% greater risk of developing MS. 4 times more common in women than men. But it's happening in men. I mean, we've got 6 veterans, 4 of them, 3 of them were SEALs, 2 of them were regular Army, and then Navy is Tim, and we've got 2 more military coming in and 1 civilian. So we'll have 9 people that will be walking through this process.
Well, no, I got to state this number. You've treated over 1,400 patients, and the testimonials obviously speak for themselves. And something I just actually got hip to, I was listening to your interview with Dr. Scott Schur, and obviously you lament the benefits of testosterone, but there was something you had mentioned about the downsides of just being on testosterone without some of the other progesterone, just other layers and things. What's the downsides of just doing the testosterone?
Yeah, if you're just doing testosterone or just doing estrogen for a female, what happens is it shuts off a rate-limiting hormone. What a rate-limiting hormone is, it's the linchpin that allows for a process to happen, and that's luteinizing hormone. When you take testosterone or you take estradiol, the body says, oh, you don't need luteinizing hormone to go and generate estradiol through a cascade. The cascade, again, cholesterol to pregnenolone, pregnenolone to DHEA, DHEA to testosterone, testosterone to estradiol, estradiol to estrone. So you've got that pathway that gets shut down. And so when you shut down that luteinizing hormone pathway because you're using, for a guy, just testosterone, you lose 35 neurosteroids in the brain. And what we commonly see, or what I used to see more often in the beginning, guys coming to us telling me the same story. I went to my men's clinic and was put on testosterone. I felt great for about 4 to 6 months, and then I started feeling like I originally came in. And I told this to my treating doctor. The doctor says, oh, just increase the testosterone. They felt good for another month or 2 and then crashed again. The reason this happened is because it takes about 4 to 6 months for you to start losing important hormones like allopregnanolone, pregnenolone, pregnenolone. And these have major impact on sleep, antidepressant, anti-anxiety. In fact, a drug came out 7 years ago, maybe 8 years ago, called brexanolone. Brexanolone, for inexpensive $34,000 a year, is what replaces the allopregnanolone that you've lost. And it came out originally for postpartum depression. But if you look at the mechanism and the hormone and how it functions, it's depression, anxiety, insomnia, postpartum depression, bipolar. It works on all these things. And we use a product, pregnenolone, which becomes brexanolone or allopregnanolone. And it's $80 to $100 a year. So it's what we've used. And in fact, the DOD, Department of Defense, and the VA 3 years ago, through some crazy psychologist started taking pregnenolone to apply in people with PTSD, post-traumatic stress disorder. I don't know where it went, but it works really well. It works really well. I know because we have over 10,000 patients. We've had over 2,000 military. This morning I was just looking at how many people are accessing our products, and we've got like 9,500, a little more than 9,500 people are utilizing our products, which is great because I'm self-funding. No one gives me any money. I work 7 days a week, and I'm not complaining. I'm just telling you what we do, what I do, and we generate money, and that money, 60% of the funds that we generate, we use for our veterans to come into our treatment protocol. Veterans, law enforcement, fire department, active military. When they're active military, we donate more for them to come into the program. We've got contracts with pharmacies, so a medication which is $600 for 6 months supply is $75. And then we, give our vets, 30, 15, 20% discount on their treatment protocol as best we can. And this is how we've gotten so many people, so many military to go back to quality life. And I talk to them like Tim.
Yeah, as I'm saying, like to him, the testimonials that they just speak for themselves. Andrew, Tim, I can only imagine. I mean, obviously you're doing it. This is a labor of love. I mean, the line out the door should be just absolutely endless with the work you guys are doing. And I know it's not just veterans or people who combat sports. With what we're understanding now about how brain injury happens, it doesn't have to be traumatic, and how you guys are going about treating it is absolutely next level. Something you mentioned about stripping away in one of our texts, the term oligodendrocyte. I always remember from early anatomy and physiology, and I always found it such a fascinating term. But then when I got into what it was, it's absolutely insane. So when you start talking about stripping things away, talk to me about the role, the correlation they're making between statin drugs and Alzheimer's and just different brain degenerative, how it affects the myelin, which then affects the creation of the Schwann cells, which create the myelin, all that good stuff. What's the role of oligodendrocytes and the role of statin drugs and the potential increase in these neurodegenerative diseases?
Well, it's a big question. Statin drugs drop the amount of cholesterol, and as I specifically was stating repetitively, is that our entire steroidogenic pathway is premised on adequate amount of cholesterol. Cholesterol is not the demon that's been made out to be in the majority of cases. And the statin drugs in lowering the production of cholesterol means that you remove the base chemical that becomes all our hormones in our brain. So there are articles, and if you go looking for them, they are talking about when you drop below a certain level of cholesterol, that there's a increased occurrence of dementia and Alzheimer's. And then there's a 44 meta-analysis of 44 research projects where they showed that the extension of life on statin drugs is only 4 days, based upon these 44 research projects, or 44 studies. So the question is, then, what are we talking about? What is it really? Well, I think cholesterol was villainized because they had the ability to drop the production of it in 1986 with Merck Sharp and Dohme and Mevacor. But my argument is that in 1986, we were smoking, we were eating poorly, trans fatty acids, we weren't exercising and so forth. And then in 1986, we have a new drug to lower cholesterol that we're being told is cause for atherosclerosis and heart disease and stroke and Alzheimer's and a whole litany of things. Well, if that was the case, we've improved our nutrition, we're exercising, we're taking statins. how come the rate of all these diseases isn't nosediving? It's going vertical.
Right.
It's increasing. So it tells us that, wait a second, the initial presumption or assertions are maybe in error. And that's what a lot of people are coming out talking about, is the statins don't serve any real good purpose. Well, believe it or not, statins, when you have a traumatic brain injury, do help acutely in dropping some of the inflammation. But over a long time, it can have a deleterious effect, a harmful effect. So what is the whole deal? Oligodendrocytes need byproducts of cholesterol to stimulate their production of myelin. Myelin, oligodendrocytes in the brain, Schwann cells below the neck and the spinal cord for myelin to coat the peripheral nerves. And so we need DHEA to stimulate the production of myelin from the oligodendrocytes. We need estradiol, we need pregnenolone to stimulate, progesterone to stimulate the production of myelin from the oligodendrocytes. So when you have inflammation in the brain, something called interleukin-1 beta shuts off the oligodendrocytes. You need to turn them on to make the protective coating for nerves, because inflammation will destroy the coating of nerves and cause loss of conduit conductivity. Nerves have a body, and then they have a long strand that they call an axon, our axon. And that axon is what connects to other neurons, to convey information through electric signals, impulses. And the change in the membrane because of inflammation leads to dysfunctional ability for these, they call it the gated ion channels, to create an electric discharge, potential, electrical impulse to transmit the information from one neuron to another, from one side of the brain to another, from one lobe to another, from the occipital lobe in the back, which is where our vision is, to the temporal parietal lobe, so you can interpret what you're seeing, the frontal lobe, which is damaged by Alzheimer's disease from hyperphosphorylation of tau protein. You get the tangles, you get the beta amyloid. All these have a trauma inflammatory. There was an article that just came out recently corroborating that these Alzheimer's processes are all inflammatory. Well, duh. It's been in the literature for a long time, but no one's looking at it. And the reason why the medication that they developed for Alzheimer's is not working, because they're premised on the ability of these medications to protect a very important neurotransmitter called acetylcholine. These two drugs are acetylcholine esterase inhibitors. It's an enzyme that destroys acetylcholine, but we want to keep it. So we give them these medications. And it turns out that because of the inflammation that's going on in the brain, they're not making acetylcholine. So you're giving them a medication that doesn't have a target, acetylcholine, to protect. That's because the inflammation has shut down the ability of the neurons to make neurotransmitters like norepinephrine, epinephrine, acetylcholine, serotonin, NMDA, SIG1's receptors. All these neurotransmitters are diminished. If it makes it, the inflammation won't allow it to be released into the synapses, into the synaptic cleft, the communication between one nerve to another, the presynaptic to the postsynaptic, neurons. So this is why transmission becomes defunct, and why you develop things like foggy thoughts. A great example is when you get a cold, a simple viral cold. You get irritable, you get fatigued, you get moody, you don't want to eat, you just want to be left alone in a dark cave. And that's all predicated by interleukin-6. It's a pro-inflammatory cytokine. And there are things we can do to reduce it, like DHEA reduces it. And that comes from cholesterol.
I hear you mention that a lot, DHEA.
Yeah, DHEA, phenomenal. I have a 3-hour lecture on DHEA and pregnenolone, their origin, their function, and looking at separate things. DHEA below the neck protects your heart from ischemic heart disease based upon the Massachusetts male aging study. They have female studies where it protects it from the ischemic heart disease, heart attack. Articles on DHEA lowering the risk for cytokine storm by stopping an overaccumulation of white blood cells in the lungs so that they can dump their cytokines. It helps with wound healing. It helps balance out insulin and glucose. It helps with anti-inflammation below the neck, and it helps stimulate the immune system. And it has, incredible amount of benefits in the brain. Taken at night after dinner, it increases growth hormone production in the males by 10%, 15 to 20% in females. DHEA in studies that started coming out in 1952 as an antidepressant. And then 1997, and Dr. Morales did an incredible study showing that it can stop depression in 30.1% of the cases. It also, directly stimulates the oligodendrocytes, and we found people who have issues with myelin production. It turns out that they have a receptor defect for DHEA, and it's specifically DHEAS, the activated form in the brain. So, by taking supplements of it, it might work very well. And if you have a receptor problem, you need something else like pregnenolone, allopregnenolone, and estradiol to stimulate the production.
Something I was talking to somebody about, I take supplements a lot, and a good friend of mine, we were talking about the bioavailability of those supplements. You might be able to take them, but if you don't take them with a meal, the stomach acids could eat them up, et cetera. What is something that could help facilitate the bioavailability? Because those things get expensive. I mean, it's cheaper than pharmaceuticals, but I mean, at the end of the day, you don't want to be just absorbing just a small percentage of the things you're buying. Right. Is there something that someone could buy to help increase the bioavailability of the stuff they're taking?
Well, there's a way you can buy it in a liposomal form, understanding that there are different renditions of vitamins, like the most common vitamin C is called ascorbic acid. I don't use that. I use ascorbate palmitate, which is a fatty acid, palmitic acid, palm oil attached to vitamin C, which makes it rapidly absorbable, and it goes through the blood-brain barrier into the brain. You can, on things like DHEA, vitamin D, and pregnenolone, you take it 15 to 30 minutes after a meal because they need food to be absorbed. They're fat related. So those are the issues that we give to our patients in their treatment protocol. It tells them when to take it, how much to take it, what variation to take it. You can take zinc in 5-6 different formats. Zinc citrate's the best. You can take selenium as selenium sulfate, selenium whatever, but the best one is selenium methionine. So it's understanding for absorption, there's a structure that you need. Iron citrate for anemia as opposed to iron sulfate that'll cause black stools and might not get absorbed as well. It might be injected. So there's a lot of information out there. You can go to, ChatGPT and tell ChatGPT, hey, you are a top neuropathophysicist with expertise in nutrition and pharmacology of nutritional products. What's the best formulation of zinc, of selenium, of whatever? And it'll tell you how to get it absorbed. All our products, all our brain rescue, brain care products are nanoliposomal. What a nanoliposome or liposomes do is they envelop the product in a coating like a cell, and small enough it passes through the pores in our blood vessels right into our system. And the coating is like a cell membrane, and it's a lipid, cholesterol lipid membrane, which deters the damage from hydrochloric acid in the gut. So taking liposomes, you can take it anytime you want. It doesn't matter if with or without food, because the liposome protects it from the hydrochloric acid that would normally destroy it. And that's why you have to take so much vitamin C. Basic vitamin C gets destroyed by the hydrochloric acid in the gut.
Interesting.
Yeah.
I'm not going to keep you too much longer. A couple more questions, and
Sure.
I will let you slide, my friend. I don't know. I'm quite sure you're probably familiar with Gary Brecka.
Sure.
A couple of one thing that stood out when I saw him on Joe and listening to him talk to Dana, and they had Dana White on all these medicines, but all this stuff was still going crazy. A term and what stuck out to me was I think it's an amino acid called trimethylglycine. And trimethylglycine, how it inhibits the production of homocysteine. Talk to me about the importance of both of those things, trimethylglycine to inhibit the production of homocysteine, and why homocysteine is so bad.
Well, I always look at the deep dive.
Sure.
Okay. Here's the question that should be asked. Why are we generating homocysteine?
I don't know.
Hey, that's the question that needs to be asked. And then the trimethylglycine, you can, betaine is the other name for it.
Yeah.
You can basically not need to take it if you fix the real problem. What the real problem is where does homocysteine come from?
Inflammation?
No. Homocysteine causes inflammation. High homocysteine is not good for TBI. Where homocysteine comes from is an amino acid called methionine.
Ah, yes.
Methionine, why is methionine so great? Well, it's a sulfa-bearing one, very important. It's a necessary amino acid to take in, but it's also called the initiator amino acid for protein synthesis. So what happens is, if you're generating proteins, methionine sits down on the ribosome, and then the transfer RNA comes along and starts building the protein, building the peptide. Then it becomes a protein, and then it releases it, keeping the methionine to be used for the next process. But if you're deficient in IGF-1, insulin-like growth factor, growth hormone related product, if you're deficient in it, what will happen is you'll have deregulation or dysfunction of this process of protein synthesis at the 40-60 subunit of the ribosomes. So you'll get interrupted production of proteins. So what happens is the system says, make a testosterone. It starts building it, and then it breaks off because it doesn't have a quality ribosome. So the peptide goes into the circulation with the methionine hooked onto it. The protein, the peptide gets sheared off or cleaved off, and you're left with methionine, which gets converted into homocysteine. So fix the intracellular system of protein synthesis, and you do away with homocysteine. You can go online to Google Scholar and put in homocysteine and growth hormone, and it'll talk about how growth hormone helps to diminish the production of homocysteine. And it's not because of directly destroying homocysteine with the B6, B12, folic acid, or with betaine. It's, betaine's good for the gut anyway. It's the fact that you're stopping the production of homocysteine at the source. So everybody's looking at the periphery. We don't go to the deep dive and address things. It's like why we don't use antidepressants in our patients with TBI, PTSD, and whatever else you want to call it is because we do the dive into the causation. We don't treat the superficial. We treat the causation.
Yeah, and that's usually what the pharmaceutical industry tends to do, and other, just kind of putting a Band-Aid on it, like you said, as opposed to getting to the root causes. Sir, I am going to let you slide, but this term that you've used to describe what you do, and you can listen to this episode and all these episodes, what he does, and what he describes what he does is translational medicine. Give me the lowdown on what that is. Describe that for me, if you will.
Sure. Translational medicine is the fact that there are brilliant researchers who have published tons and tons of research, articles on work, like a lot of the things that I've already regurgitated are based on their work. And so what happens is I'll read an article that says that the use of growth hormone will drop homocysteine level. So I get people high homocysteine, I put them on to differing kinds of IGF-1 growth hormone stimulators. I use a secretagogue like dinotropin or secretropin and monitor them and their homocysteine level, and you see it dropping. It's what they said in the literature. Now, what I'm looking for, the research that I read that fails. So it means that their science is flawed someplace. But one of the things that I do is I'll read 5, 6, 7 different articles on the same subject matter from different research centers, different authors. And I'll correlate the two like a meta-analysis and see if the number of articles that say, yes, it does work is greater than the ones that says, no, it doesn't, or the ones that says, no, it doesn't is greater than the ones that says, yes, it does. And I weigh, like the, blind justice, I weigh the science to see which one really is the preponderance of evidence, the one that has the greater amount of evidence supporting it or denying it. And then I go test it out. And that's what translational medicine is. You take the science and you apply it in a clinical practice. And I had lots and lots of people in our clinical practice who were open and very receptive to trying things out. You know, we paid for it. I mean, I went through a lot of cash on getting people to do these programs, but it paid off with a lot of great science. And that's how we built our Brain Rescue 3, which is a product that we used with our Marines out of Camp Pendleton. I went and gave a lecture, and the next day they started sending me some of their Marines who were getting ready to be medically discharged, put them onto a protocol of Brain Rescue 3 for every morning for 90 days, and every month they would fill out a questionnaire, and their results were phenomenal. Migraines disappearing, depression disappearing, sleeping better, irritability improving, and it's all based on addressing the inflammatory chemistry in the brain, as well as upregulation of mitochondrial function, like Rhonda Patrick always talks about. I've been into mitochondrial functioning since, my early days in science through an article out of Scientific American. The article was cutely titled, Yes on No. Yes on No. Well, the NO is nitric oxide. And nitric oxide, stimulates some mitochondrial regeneration. So nitric oxide, very important. Quercetin, very important. N-acetylcysteine, very important for mitochondrial functioning. Magnesium. So, and PQQ, I have 2 new series that have come out or coming out. One is on peptides called Peptides for Health. It's on my YouTube channel. And then I'll be dropping this week the first in Supplements for Health, which is on PQQ, which is one of the ubiquinone members of the CoQ10 family, which is incredible in terms of stimulating mitochondriogenesis, increasing energy. We have it in our products, and it's responsible for helping to generate more ATP, which is the energy molecule of our entire body. And when you have trauma, the inflammation in the brain, the inflammation any place in the body, causes mitochondrial dysfunction, so you cannot make the appropriate amount of ATP. And a lot of articles talking about why cancer gets a foothold is because mitochondrial dysfunction. You go into fermentation when you have, cancers, and you generate 2 ATPs. Normally you generate what? 37, and with carbohydrates, and 98 with fats. Fats are a more energy dense product, and they're much better. It's just how to put them into the body so they maximize benefits with minimizing side effects.
And is this everything we can catch up? MillenniumHealthStore.com?
No, this is at, there are 3 sites. My primary educational website is tbihelpnow.org, and there's videos, media, a lot of the media things I've done, some Joe Rogan's, ESPN Outside the Line, Radfest, where I did the 17-minute presentation on In Search of the Prozac Gland. Then there's the science, which are articles, key articles that transformed me into what I'm doing now, as well as some of the 20 articles that I've put out there. Psychedelic, one on psychedelics. There's one presently on gender dysphoria, which talks about the glyphosates passing from our mother to the womb, causing interruption of the hormone spark that causes us to recognize XX for female or XY for male. And then
is that the introduction of the atrazine I always hear about? Like, what's his name? Alex Jones talking about they're turning the frogs gay. It's kind of jokingly, but it was about
Yeah, that was research where the gender was converted. They're hermaphroditic. Self-insemination.
Yeah.
But on that, as well as the article that got picked up by George Washington University and Walter Reed was neuroinflammation, the road to neuropsychiatric illnesses. You correct the underlying inflammation, and you have a great chance of returning people back to who they were before their traumas. We've trained 29 psychiatrists. We have 7 very active. We have 2 major, one in Florida and one in Hawaii. Dr. Jason Kiefer in Hawaii and Dr. Meisel Demaya in Punta Gorda, Florida, who are being overwhelmed with psych cases being referred to them by their colleagues who have difficult cases. What she does is she just follows our protocol, doing the biomarker panel, and then addressing the biomarker panel results by correcting what it says. And we have a computer software program. It took me 10 years to write. My background was computer electronics before my dad died of bone cancer, ex-Army. And I kept my finger in the computer world and wrote a program that interprets the labs so that anybody can access the laboratory panel, put it into the software, and have a 12-page report that tells them what's wrong and how to fix it.
Jack of many trades over here.
So we've got 120 some odd clinics in 12, 13, 14, 15 countries that are using the software.
Amazing. Absolutely amazing, Doc. And look, I have a big star by this in my notes, so I don't want to let you slide. You're talking about articles, and I'm bass backwards with this. I should have led with this, but please, if you don't mind, before we slide out, the epiphany, and I found that kind of interesting that you used that term. The epiphany you had reading an article from Turkey about boxers and their high count of growth hormone deficiency, and you wound up making that connection, trauma equaling hormone deficiency, and it spirals into so many other deficiencies. And again, like I said, I should have led with this, but that article and how it really was the catalyst to a large degree, and how the epiphany you had.
Yeah, that was probably someplace around 2001 to 2004. In my deep dive at literature, I came across this article on pugilists, boxers, fighters in Turkey. Turkey, everybody's a boxer. And they were talking about some of the psychiatric conditions that happened. So what happened out of that article, I went back to my population. Now, from 1995 until 2000 and probably 7, I was doing anti-aging medicine as a focus. 2007, I released my first book called Interventional Endocrinology, which was my term for anti-aging medicine. I didn't like the term really anti-aging medicine. It made us look like kooks, but now it's acceptable. 17 years down the road. And I went back to my population who had all been being treated for psychiatric-related stuff with hormones because hormone deficiency, and they got better. So I went back and I said, okay, did you ever have any head traumas? And every single person said, yeah, I was assaulted. I had a motorcycle accident. I had a slip and fall. Plane crash. We had a couple of plane crashes and just incredible stuff. And it became a pattern. They had a prior trauma that created the hormone deficiency that I was picking up. Everybody thought it was genetic. Everybody thought it was genetic. And the gentleman that in chapter 5 of my first book, it was my first attempt at putting together the science on trauma creating hormone deficiency, a kid by the name of Michael who had a motorcycle accident, who loss of consciousness. I think he was in the hospital in a coma for 3 days. And when he came to, the neurologist says, oh, you'll be great. Nothing will be wrong. Well, he subsequently became not good from a multitude of layers. I won't go into specifics of it, from medication, drugs, crime, and so forth and so on. And his parents, who had already been patients, said to me, our son is having symptoms and problems just like we had. It's all genetic in the family. And that's how I took him in. Yeah, it's a genetic thing, never looking at his accident until years down the road. 7 years, 5 years down the road, 6 years. So it became a pattern, and that's what drove me to look at trauma, mood swings, emotional changes. Hormones became a part, and they became all together. And I did a flip in 2010-11, where my focus was hormones caused the personality changes to inflammation caused a hormone deficiency that creates. And what helped to solidify that was a 2013 article that showed that the inflammation in the brain shuts off the ability of an area of the brain called the hypothalamus to release the primary hormone called gonadotropic releasing hormone that tells the pituitary to release luteinizing hormone and follicle stimulating hormone. So when you have inflammation, that is shut off, so you can't turn on sperm and ova production, so you're infertile, can't turn on production of luteinizing hormone. For women, the thecal cell produces testosterone, estradiol, progesterone, all the hormones, and in the Leydig cells of the testes produces testosterone, estrogen, and all the hormones similar to thecal cells. And what compounds this whole thing even more is that people who have gotten COVID, either through natural means, by contagious, and or the people who have received a vaccination, that the spike protein causes inflammation throughout the body and is now apparently responsible for infertility and a lot of the cases of hormonal deficiencies that I'm seeing, and that's in the literature. It's now in the literature.
That's a very fascinating conversation that obviously is way too much to unpack now, because that whole spike protein thing from this is definitely, it's a thing. And it's like you said, women's menstruation cycles, infertility, we're going to be finding out more and more information about that. But that is definitely something that we're finding out is definitely has some truth to it with the spike proteins. Good doctor.
All right.
No, thank you so much, man. I really appreciate you. Any shout out? Where can we follow you on socials or whatever you want to shout out? I can add to the description of this episode, sir.
Yeah, well, I'll send it to you. I mean, the places, the primary education is the key. Then there's all the new videos that I'm dropping, one a week at my YouTube channel, which is @ Mark L. Gordon 5856. And then lastly, our products are at millenniumhealthstore.com, and I'll send you a discount code for all your listeners who want to try some of our products.
That'd be awesome.
Which have been absolutely impressive in all our population. As
Well,
I said, over 9,500 people using it.
Yeah.
Yeah.
The proof, ladies and gentlemen, is in the pudding, and he's put in the work. And we're going to set up a part 2 of this episode. It'll be a separate episode where Dr. Gordon's going to come on with Lisa McClellan, so she can talk about the work that she's seeing firsthand in the examples of how his work is absolutely changing the game over in the household of the McClellan family, man. If you listen to the episode with Lisa, Gerald's definitely getting back into his old self. So I can't thank you enough, Doctor. I appreciate your time, continued success, and appreciate you. Thank you so much, everyone. You know what it is. Stay tuned. There'll always be more.